Here in Fife, this team is finally able to give frontline NHS staff the tests they've so urgently needed. Up and down the country, access to the throat swab that tests for coronavirus itself has stood between doctors and nurses treating coronavirus at work or sitting at home not knowing if they're infected.
And there have been times in our emergency department that we've been down with one in four members of staff down in children's A&E. I myself have been off self-isolating, and other members of my team have. This is going to become more and more an issue.
The new target of 100,000 tests a day by end of April will solve that, but the peak in cases could be on us by then.
For weeks into the outbreak, there were delays here. How can you explain those delays?
This is about building a whole new and very large capacity very quickly. It just takes some time to get that right, and unfortunately that's taking more time than we had either hoped or intended. There's a huge amount of work going into making absolutely certain that comes on stream as quickly as possible, because it is a critical part of the response that's required.
Just as well, scientists at labs like the Francis Crick Institute in London have taken matters into their own hands, designing a rapid COVID-19 test for staff at the major hospital up the road.
By working basically 24/7 for 2 weeks, we've got it in place. After the weekend, we should have 500 tests a day. We hope soon after that to be able to go to 2,000 tests a day.
Their method relies as little as possible on the swabs, chemicals and disposable lab kit that's now in such short supply it's causing testing delays everywhere else. This institute relies on donations from charities like Cancer Research UK to carry out its normal work. They're happy to drop what they're doing to tackle COVID-19 and stop short of criticising the government's handling of the crisis. But
when we get through this, we need to take apart what the discussions were that took place. Could we have been better prepared, and what needed we to have in place to be better prepared? So I would point my finger at adequate preparation.
with labs around the UK making similar efforts, it looks like our scientists will throw the NHS the lifeline it needs until the government's next testing targets are met. Tom Clark, News at 10.